There's one more question is, what about people who've had cataract and they have dry eyes? Which category would they fall into, or does that not, do they have to assess that?
No. Usually it's not aqueous-tear deficiency, but usually it's evaporative dry eye. So what happens is two things can happen. There are two surgeries which can worsen your dry eyes. One is cataract surgery and the other is refractive surgery. Refractive surgeries like Lasik, etc., that people get done to get their glasses removed. What happens after cataract surgery is that the medications that we use after cataract surgery, the eye drops, which are usually a combination of steroids and antibiotics, because they are used for a certain period of time, they can often cause transient blockage of the meibomian glands. Okay, and therefore again, you can make your you can develop meibomian gland dysfunction after cataract surgery because of this problem. It's usually related to eye hygiene. A lot of times the hygiene is not optimal after cataract surgery when they're using the drops, and that causes blockage of the glands. The other possibility is that somebody with a subtle preclinical form of dry eye, after cataract surgery, the dry eye manifests and then it becomes worse. But what you have to understand is whether your symptoms are, so dry eye is by definition a bilateral condition. So if you are only symptomatic in the eye which has had cataract surgery, it is probably evaporative dry eye because of the eye drops that you used after that. It can be cured completely, and blinking does help. Lubrication also helps. A little bit of improved lid hygiene can make a lot of difference.
Okay, thanks. One more question which has come in on allergies. 1 second, let me read it out. Can dry eyes be an outcome of severe allergies? Assuming severe allergies lead to release of histamine, and hence doctors have recommended antihistamine.
So both dry eye and allergies come under the broad heading or grouping of ocular surface disease. Okay. However, they are completely different diseases. The underlying pathology is different. I know that a lot of times people use these diagnostic terms in a very loose way, and sometimes that leads to a lot of confusion. But typically patients with allergy have the exact opposite of dry eye. They might have certain similar symptoms like light sensitivity or irritation or itching, etc. But mostly patients with allergy have watering and not dry. So you will see that these are patients, who have puffy red eyes and their eyes are watering. The dry eyes are usually exactly the opposite.